The News Hour Special Edition.
Welcome back. Well, viewers, it's a public health emergency in the national capital with Delhiites being forced to breathe poisonous air. The air quality has plummeted and it is in the severe category. The AQI is nearing 500. According to data from the Central Pollution Control Board, Delhi's average air quality index stood at 461 today. Visibility across the national capital region remained poor throughout the day. And given the grim situation, toughest anti-pollution curbs under the fourth and final stage of the Graded Response Action Plan have been implemented. Under these restrictions, all non-essential construction and demolition activities have been banned. Schools have been asked to shift to classes in hybrid mode. Offices will call only 50% staff while giving work from home option to the others. But people are concerned and they're asking, do we really deserve this? And year after year, it's the same old story. We have to grapple with the same crisis. These are, in fact, particularly troubling for children and the elderly who are experiencing difficulties in even breathing. Those who have resources are even considering leaving Delhi altogether for a while, and some have already done so. But for those who have to put up with the poisonous air, like you and me, what's the best possible escape? Or is there any at all? To help us get answers to this, we have a panel of health experts joining us today to break it down for you and tell you what is it that you can do and what are the solutions to this air pollution problem that we have been dealing with every single year. Dr. Ishwar Gilada, infectious diseases expert and Secretary General, Organized Medicine Academic Guild, joins us on the broadcast. Vimlendu Jha, environmentalist. Kanak Gupta, co-founder of My Right to Breathe, on the broadcast with us. And I want to begin with Kanak Gupta. The air is unbreathable. It's very, very difficult to breathe. What can be done? Now GRAP 4 has been implemented, but is it too little too late that we see every single year?
Well, I'm so glad that you started off with that this is a health emergency because, you know, we've been saying this for a while now. This is a public health emergency and has to be taken care of all year round. This has to be reacted not just with a GRAP 4 suddenly, because this is reactionary. This is not proactive measures. Everything that we are doing right now will provide very minimal comfort to everyone. This has to be all year round. The action has to be taken all year round. We need to understand, you know, I was just looking up an app while you were on a break. There's about 23 cigarettes that the Delhi citizens are smoking every day by just stepping outside. Now, if that doesn't scare our politicians, our powers in, then I don't know what else would. It's probably a little too late, but I'm still, the eternal optimist. I really hope that the politicians can get into a room and discuss, figure out, listen to some experts like those on your panel right now, and figure out a plan of action all year round. It's not just about the Parali or the Diwali firecrackers. It's about, the pollution that comes from construction, from the vehicles. All of that needs to be controlled. There has to be a consolidated plan of action, not reactionary measures. What we've taken with GRAP 4 right now, you put the kids in school, there's more problems. If you have people not going to work, you have problems going up again. You cannot rush all your elder citizens to the hospital.
What is stopping political leaders from really taking action? That's the question. We have our viewers also joining us on the broadcast because we want to know from our viewers as well and get their voices as well. Before I go to our viewers, I also want to go across to Dr. Ishwar Gilada for a real understanding of what it actually means. Because, for many people, we talk about how the air is so difficult to breathe, but what is the actual impact that it's having on our body?
The actual impact is this annual ritual. It's happening year by year and increasing day by day. The impact is on those people which are already having a problem like asthma. Yes. But it is not only on those, it is on children, on pregnant women, on elderly people, and each one of us is just give you a simple example. When India got independence, our average lifespan was 32. It is now 71 for male and 73 for female. But for 10 years, it is stagnant. It is not going to 81, 82 as we compare ourselves with the fourth or fifth economy and with other top 10 or 20 countries. So we are lagging behind. And one of the main reasons is pollution. It's not only air pollution, it's water pollution, food adulteration. And when we discuss anything which is related to health as an emergency, there's a politics in that. So there is a politics in pollution and there's a pollution in
politics and pollution, but are the people suffering because of the same? Brigadier Sanjay Khanna joins us on the broadcast. Thank you for joining us. What do you think is really stopping the political leaders from taking action? So it's really difficult to breathe, isn't it?
I fully agree with you. And surprisingly, it's the politicians also are breathing this air.
Yes.
Though I fully agree that they have air-conditioned cars and air-conditioned homes and purifiers are being utilized. But still, they are also exposed. If they have small children who go to school, those children are also exposed.
Yes.
So it is not a matter of the politicians or the bureaucrats or anybody. It has to be a collective nationalistic effort because these things it's been going on for donkey's years, and every year in the month of October, people start crying hoarse, and then it falls on deaf ears. So nobody's bothered.
Yes, and also, is it, during this time there is a lot of outrage, after which it is forgotten completely. But Vimlendu Jha, there is a lot of discussion around what are the key reasons, and first it was Diwali, then it became about farm fires, but even farm fires have been dropped by about 77%, and yet we have this.
Yeah, absolutely. So first of all, we need to understand that air pollution crisis is not Delhi specific. Delhi get disproportionate attention because it's the capital. Reality is that you are in Noida, and Noida doesn't belong to Delhi. I'm sitting right now in Gurgaon, and Gurgaon is not in national capital of Delhi. And similarly, Bombay and Calcutta is not part of Delhi. So, if you look at the studies that's actually come, almost 80 to 90% of India's air throughout the year is almost in the category of poor to very poor to severe plus. Of course, the pollution gets visible in the month of October, November, December, and that's when there's some bit of conversation. And I would rather call it lip service than actually even a conversation that is done. Of course, there are sources which is known to us. We all know that almost 50% of the pollution load, at least in Delhi NCR, is from the vehicular sector, from the transport sector. And primarily when I say vehicles, I'm talking about private vehicles, which basically means that the solution is also fairly simple, which basically means that public transport regime needed to be improved, not just for Delhi, but for the entire region, because there are almost 70 to 80 million people who live here. So, similarly, look at the amount of money that we are allocating for Clean Air Program. We have allocated 20,000 crores for 6 years, which comes to an average of around 3,000 crores per year for almost like 130 cities, which comes to peanuts for each city. And only action that we actually see visibly, invisibly we don't see anything because there's nothing. The only action is sprinkling water over dust. So you're almost settling or pretending as if people should know that you are very, very active. Reality is that sprinkling of water is not a solution. Sprinkling of water only in certain sections is not a solution. We don't even know the data, as you rightly said, that it has neared 500. But do we understand the difference between 500 and 700? And 800, because our air quality monitors will not operate beyond 500, and therefore you could perhaps be having 3 times more than 500, which is 1500 AQI or PM 2.5 level of 600, where the permissible limit is perhaps 5 in
and
that
again,
sense.
it's the same cycle, taking very short-term measures, not really thinking long-term, because of which we're going to have the same problem next year as well.
Absolutely. So if you look at GRAP, the reason for GRAP, the logic behind GRAP, or the rationale of GRAP was not as a governance measure. Unfortunately, you and I and everyone think that these restrictions are solutions to pollution. GRAP was primarily a precautionary measure so that the situation doesn't become worse. So you actually bring in GRAP 2 so that we don't fall into GRAP 3 category, which is severe. We bring in GRAP 3 so that we don't fall into GRAP 4.
Instead, it's implemented when the situation has already reached there. Just a moment.
Absolutely.
I also want to bring in Gopalakrishnan, our viewer, joining us. Thank you so much for joining us. What are your thoughts?
Thank you, Mamta, for giving us an opportunity. The main issue is the political will. The politicians doesn't want to do anything on this. They only wanted to bring GRAP 3 and GRAP 4 and put the people into the maximum difficulties. Now, another member was just talking about, bringing a regime for, public transport. If you can stand at ITO or any of the major intersections and look at, the DTC buses, 90% of the buses just goes without any person inside the bus. It's only the driver as well as, the conductor. That's all. There is no people. So the question is that it is not the buses which is less. It is not because of the trains which is less. There is enough of this is available, but implementation is seriously
and also
lacking.
End-to-end connectivity as well, which is a problem, which is why not many people really take public transport, because there's no end-to-end connectivity. Thank you so much for joining us, Dr. Ishwar. I want to ask you, is there anything at all that people can do to maybe offset the harm that is coming from this air, apart from, of course, sitting in your homes and ensuring that you don't breathe that air? Because what is it that we can finally do?
You see, first and foremost, those people who are smokers, they should stop smoking. And that has never happened. Despite all this kind of pollution, the smokers do not stop smoking. Use N95 mask or good mask. Use water air purifier at home if it is possible. And you said in your intro that where do people go from Delhi? Wherever you go, there is the same problem. There's a big article today in Mumbai about Goa. Some family shifted to Goa, and Goa's some villages are as polluted as Mumbai. So I think there is no place which is safe. And therefore, what Varnendra was saying, or Vimal was saying, that we do not care about prevention. We have to make policies well in advance. Pollution has to be considered national security. And that is what is in China, is national security, public health emergency, public health crisis.
Public health crisis, Kanak Gupta, what are your measures, implementable measures that we can do in the Delhi NCR region, very quickly?
So I think, clean air is not a lifestyle choice anymore. But, unfortunately, we have been forced to make it a lifestyle choice. Limiting outdoor activities, not indulging in sports, those are the only things that we can actually do for now. But we need to practice as citizens, as individuals, measures that will take place in the long run. Carpooling, controlling construction, those are the things we'll need to do as citizens, because clearly there is no political will in this country to do anything about it. Most of the heavy lifting will have to be done by the citizens. I'm not very hopeful for the change coming from the politicians. Okay,
that's very unfortunate, and we really hope that this today and what we're seeing in the last few days serves as a big wake-up call to the political leaders, because as a viewer pointed out, political leaders are also breathing this very air. They should wake up, because this is an air emergency. Thanking our guests for joining us this evening and our viewers for joining us. Quick break. We'll be right back.